Bonjour, welcome back to the Dr.Roze Biohealth podcast. My name is Natalie. I am your host today. Just before we start, a quick reminder, if you do have any questions, please don't hesitate to drop us a message on our social media platforms at Dr.Roze Biohealth. I am honored to be with my guest, Dr. Carla Schweer, again for another podcast.
Hi.
Welcome back. A brief summary about Dr. Carla. She's German and French. Did I get that correct? Yes. She speaks German, French, and English. She studied in France and then she worked internationally before coming into Dubai. She is a real leader in biological dentistry. She was brought up into the holistic world and she's also part of our scientific committee at Dr.Roze Clinic because we always strive to give the best to our patients, don't we?
Exactly.
Yeah. So today we're going to discuss a topic that we talk about on a daily basis at the dental clinic, and that is amalgam. Amalgam. Why is it safe? And I mean, why is it not safe?
You should get amalgam.
Okay, I take that back. Why is amalgam filling bad for you and the detox that comes with it?
Yes, because we had this topic already, right?
Yes. So we did have a previous podcast with Dr. Jumeirah mentioning about the amalgam filling, but we're just going to cover it quickly so we understand from your perspective what exactly is amalgam filling.
Yeah, okay. So just to remind what is amalgam filling is these gray fillings that you have in the back of your mouth. It's a combination of different metals. And one of the metal is liquid, is the mercury, is 50% of those fillings. Is the only metal that is liquid at ambient temperature. So that is why it's used. It's like glue to hold all the other metals together. And this metal is a heavy metal. It's a body burden, basically. It's neurotoxic and it's a heavy metal because it's accumulating in your body.
How bad are they for our health?
Yes. The World Health Organization classify heavy metals as neurotoxic. Even smaller amount of exposure to mercury can damage your brain, lungs, and kidney.
Oh, wow.
And can damage the nervous system.
Why is it still in the market, and why do other dentists still use it?
Because there's always a gap between research and then the health authority allegation or instruction. But there's still advancement in that. Finally, in 2018, the Food and Drugs Administration recognized it that it's a risk, but only they do it. They say it for vulnerable people like pregnant women and young children under the age of six, and people with neurological and autoimmune disease. But we still wait that they finally extend it to all of us because it's definitely nothing that you want to have in your mouth.
Yes.
Did you know, Natalie, that when we remove an amalgam filling, we are not allowed to throw it in the normal waste garbage?
Oh, I did not.
Yes, we are supposed to put it in a special container and to a special waste.
Obviously, I've not been a patient that needed to get the amalgam removal. So in that aspect, I don't actually know the steps that you take. Can you give us a brief summary of what is the safest way to remove an amalgam?
Yeah, so the best way, of course, is to not get any amalgam filling. But if you have the bad luck to have amalgam filling, then then you shouldn't remove it because if you remove it, then you will get even more of the heavy metals. If you still want to have it removed, you need to have it removed in a very safe way and protected environment. So we at Dr.Roze, we use the SMART protocol. Mm-hmm. The SMART protocol was invented by the IOMT and it follows...
what is the IOMT?
Yes, it's the International Academy of Oral Medicine and Toxicology.
Okay,
it's
makes sense.
Yes.
Okay.
and they give, on a scientific base, they give some steps to go through to remove safely amalgam is very strict, and it's there to protect the patient, the dentist, and the staff. So to go through very quickly, you can find everything online. You even can have the list of the needed material. So the patient should be protected, fully covered, the clothes, the hair. Each tooth should be isolated with a dental dam, oxygen to isolate the nose. The staff should have also oxygen mask, either with charcoal base or charcoal filter. Each patient also gets a slurry of active charcoal or chlorella before the start of the procedure.
So is this now part of the detox that you would recommend the patient?
No, this is just a safe way to remove amalgam, as you asked me.
Sounds like a quite complex procedure, but of course you do take so many steps for the safety of your patients and of yourselves. So please tell me, once the detox then comes in after the removal?
Yes, exactly. I tell my patient removing the amalgam filling is just the pit of the iceberg. It's not because you just remove your amalgam and that you are free of mercury.
Yes.
Because it's bioaccumulative and you had this amalgam filling since a very long time.
Yes.
You have full of these heavy metals in your body.
Mm-hmm.
So this is why it's important then to start a deep detox if you really want to get more healthy.
Yes, of course, I understand. So what are the steps to this detox?
Yes, basically do it yourself. You can find, of course, a recipe on internet. It's a wide topic. But you can have also professional help, even by the do-it-yourself with a prescription. We at Dr.Roze, we always give a prescription to our patient. But also we have a lot of patients that are referred by their functional doctor. Having the amalgam removed is part of the detox. And they will then continue with the functional doctor. The functional doctor can either do also a prescription. But the other way to chelate or to detox, this is what I call the professional way, because you cannot do it only yourself. It's through IV. IV of DMPS, DMSA, or EDTA. It's also a little bit like saying there's a natural chelation or chemical chelation, because those are more chemical. You can also find it in tablets, but let's try to not make it too complex.
That sounds very complicated.
But you can have the chelation. It's through IV. It will be much more faster.
Efficient. Yeah,
it's kind of we could say, I wouldn't say, more effective maybe in a way, because you will have a quicker result. The functional doctor will do a provocational test, and then he will check your heavy metals in your urine. So for the patient, sometimes it's also nice to see result-based detox, so it can be motivation. It's a little bit more aggressive, but it suits patients who need results as quickly as possible, because they don't feel well. Yes. They're getting more and more ill. I'm especially thinking about autoimmune disease, where you can see your condition going down the road very quickly.
Of course.
So you don't want to stay like this too a long time. But for most of my patients who feel well, we will just give them a prescription for do-it-yourself, and this is the natural and also very safe way to do it. It will just take you longer time.
I love that you mentioned that you work alongside with functional doctors rather than it being a dental problem, because I understand that there is a relation to the rest of your body to actually have in.
Yes, exactly. We in biological dentistry, we don't want just to restore teeth. We want our patient to get better.
Yeah, overall health.
Yes.
Looking at every organ within the body.
Exactly.
Yes. What do you prescribe your patients at the clinic and how long for?
At our clinic, we if the patient feels okay and just wanted to do something for his health and doesn't want to see a functional doctor, we have a simple prescription of chlorella and acetylcysteine and alpha-lipoic acid and essential minerals. The chlorella will help to chelate and extract the heavy metals from the body.
Okay.
But the most important are the LAA and the NAC, and acetylcysteine and alpha-lipoic acid, that are the precursor of glutathione. Glutathione is the most important hormone of our body.
Oh.
It's the most important antioxidant that you can get, and the body makes its own. It comes out of the cell, and it will chelate it will basically remove the stock of the heavy metals that you accumulated in your cells.
Oh, that's great.
So,
and how long roughly would you recommend this for?
So, to keep it simple for a patient, we recommend it for 3 months, and then we can reevaluate. But if you can do it for 6 months, it's better.
Can we do a detox through nutrition?
It's true that we hear a lot about detoxing with smoothies and so on. Of course, it's not as effective as the IV chelation or supplements, natural supplements through tablets. But you have also very powerful food, especially when there is a sulfur atom in it, like you can find in eggs, onions, garlic, broccoli.
Okay.
This will help to detox because the sulfur atom will bind with the heavy metal. And then you also have all the antioxidant like green tea and everything that is colored food, like beetroot or radish.
I actually like beetroot, so I'll probably be okay with that too. So
you have 5 essential organs that you need to detox through.
Okay.
It's the liver, the kidney. For the kidney, you will drink a lot of water. The skin, you can do steaming. The other organ is also the colon. The colon is very complex because you have a whole microbiome. Mm-hmm. So it's also important to take a probiotic if you want to have a functioning detox. Yes. So all the pathways need to be open, basically. To these 5 organs, you will expose all your heavy metals and they need to be functioning.
So can you give me a quick free summary on detoxing after amalgam removal?
Yeah, so to resume, I would say removing amalgam is just a bit of the iceberg. You need to do a deep body detox. You can do it yourself with supplements, natural supplements. You can also get some professional help and do IV chelation. You can also, of course, do it through food, but it will take a longer time.
Well, thank you so much. That was a great wrap up to our podcast today. And thank you again for being here. Thank you to everybody for listening and for tuning in. And we hope to see you soon.